Hepatitis. Hepatitis is a viral infection of the liver associated with a broad spectrum of clinical manifestations from asymptomatic infection through ecteric hepatitis to hepatic necrosis. Pathophysiology and etiology of type A hepatitis, that is HAV. Hepatitis A is caused by an RNA virus of the enterovirus family. Mode of transmission is primarily fecal-oral, usually through the ingestion of food or liquids contaminated with the virus. Prevalent in underdeveloped countries or in instances of overcrowding and poor sanitation. Infected food handler can spread the disease and people can contract it by consuming water or shellfish from contaminated waters. SHELL, shellfish, FISH, shellfish. Commonly spread by person-to-person contact and rarely by blood transfusion. Incubation period is 3 to 5 weeks with an average being of 4 weeks. Occurrence is worldwide, usually among children and young adults. Mortality is 0 to 1% with recovery is the rule. Clinical manifestations of type A hepatitis may have no symptoms. Prodromal symptoms: fatigue, anorexia, malaise, headache, low-grade fever, nausea and vomiting. Highly contagious during this period, usually 2 weeks before the onset of jaundice. Ecteric phase: jaundice, tea-colored urine, clay-colored stool and right upper quadrant tenderness. Symptoms may be mild in children. Adults are more likely to have severe symptoms and a prolonged course of disease. Diagnostic evaluation: elevated serum transferase levels, aspartate transaminase, that is AST, alanine transaminase ALT for all forms of hepatitis. Radioimmunoassays that reveal IgM antibodies to hepatitis virus in acute phase of HAV. Liver biopsy to detect chronic active disease progression and response to therapy. Management: rest according to patient's level of fatigue, therapeutic measures to control dyspeptic symptoms and malaise, hospitalization for protracted nausea and vomiting or life-threatening complications, small frequent feedings of a high-calorie, low-fat diet. Proteins are restricted when the liver cannot metabolize protein byproducts as demonstrated by symptoms. Vitamin K injected subcutaneously if prothrombin time is prolonged. Intravenous fluid and electrolyte replacement as indicated. Administration of antiemetic for nausea. After jaundice has cleared, gradual increase in physical activity. This may require many months. Complication: dehydration, hypokalemia, chronic carrier hepatitis or chronic active hepatitis, cholestatic hepatitis, fulminant hepatitis. Thank you.